All right, class, welcome to the lecture on the elbow and proximal forearm. This will be a relatively short lecture as we will go over the distal forearm and the wrist for class next week. Now, for the elbow joint, we have three main bones that are articulating. We have the distal aspect of our humerus, we have our radius, and we have our ulnar. The actual elbow joint proper, or the site where we are able to flex and extend our elbow, occurs about the ulnar humeral joint. This is the articulation between our distal humerus and our ulnar bone. Next, we have this more superficial articulation between our radial bone and our distal aspect of our humerus. This would be the site for the radial humeral joint. And we have our proximal radial ulnar joint. This joint region is classified as a uniaxial hinge joint. So about this joint region, we are able to flex and extend, as well as engage in forearm pronation and supination. The elbow flexion and extension action is occurring about the ulnar humeral joint, and our forearm supination and pronation action is occurring about the radial ulnar joint. As we move on, especially towards next week, we not only have a proximal radial ulnar joint, we also have this articulation on the distal aspect here as well, which begins to make the articulation for our wrist. In each of these joint sites, we do have our hairline cartilage within the joint capsule. And along with that, naturally, we have our various structures that allows us to engage in elbow and forearm joint movements. So starting off here with the ulnar humeral joint, again, this is the actual site where we are able to flex and extend our elbow. This is the articulation between the distal aspect of our humerus and the proximal ulnar bone. Going more specifically here to each of our bony aspects. On the distal aspect of our humerus, we have the trochlea. And on the proximal aspect of our ulnar, we have our trochlear notch. So these two bony sites essentially articulate with each other as we engage in our elbow flexion and our elbow extension movement. Again, about this particular site region, we are dealing with a uniaxial hinge joint. So the movements that are occurring here is only, at least for the purpose of this course, is only occurring in the sagittal plane. So we only have one plane to deal with as far as movement about the elbow joint is concerned. And this will be our elbow flexion and our elbow extension action. This joint site is reinforced by the medial or ulnar collateral ligaments. We have an anterior, posterior, and inferior bands of the medial collateral ligament. And its main objective is to resist valgus force occurring about the elbow joint. By valgus force, this is simply a force that causes the outward bending of our elbow joint. A clinical correlation for you guys here is the sprain of our medial collateral or our ulnar collateral ligament. This is most common in overhead sports. You would also see the words golfer's elbow used to describe the nature of the ulnar collateral ligament sprain. And this is just again, with any strain, it's a partial tearing or stretching of that UCL ligament. This can occur in each of the three brands. This is typically due to chronic stress, and just like any other sprain, we have our regular grade 1, grade 2, and grade 3, or we could have or experience a full tear. A full tear of the UCL may require surgical interventions. The most notable will be the Tommy John procedure, which essentially uses a tendon graft to reconstruct the torn components of the UCL ligament. Moving on to the radial humeral joint. This is the articulation between the distal humerus and the proximal radius. More specifically, this is the capitulum of the humerus articulating with the head of the radius. And you'll notice here, unlike the ulnar humeral joint, the radiohumeral joint is relatively superficial. This means that as far as the elbow joint proper movement is concerned, this joint doesn't contribute much to the elbow flexion and elbow extension actions. However, with this, we do again see this articulation occurring between the capitulum and the head of the humerus. Again, it's very superficial. And the overarching note here is that the radiohumeral joint is almost along for the ride. As far as the elbow flexion and elbow extension actions are concerned, it's mainly occurring about the ulnar humeral joint. This joint site is reinforced by the lateral or radial collateral ligaments. All right, and these ligaments attach the lateral epicondyle to the humerus to the annular ligament, as well as the radius. This annular ligament is actually very important once we move on to the proximal forearm action. And it's important because the annular ligament actually holds in place the radial head, which allows the radial bone to essentially pivot on the ulnar bone as we engage in our forearm supination and pronation action. Now moving on to the muscles of our elbow, starting on the anterior side, we have our biceps brachii, we have our brachialis and our brachioradialis. These muscles are mainly responsible for elbow flexion. Starting off here with the biceps brachii, the biceps brachii are most activated while we are flexing our elbow in the supinated position. If our hands are in the pronated position, the muscle that is most activated, if you will be our brachialis muscle. Now, the brachioradialis muscle is a jack of all trades, if you will. It's not only responsible for some sort of elbow flexion, it's also responsible for both elbow pronation and elbow supination. Moving on to the posterior aspect of our elbow, the main muscles that we'll look at will be our triceps brachii and our anconeus. For our triceps brachii, again, the main action here will be elbow extension. Also notice that the long head of the triceps brachii crosses the shoulder joint. Most specifically, it originates on the infraglenoid fossa or tubercle found in the scapula. So not only is it responsible for elbow extension, it also contributes to shoulder extension as well. If you all may recall to the shoulder lecture, the long head of the biceps brachii as well also crosses that joint, right? So again, for the biceps brachii specifically, not only is it responsible for that elbow flexion action, especially when your forearm is in that supinated position, it also contributes to that shoulder flexion action as well. Again, we're talking about the biceps long head in that case. All right, you all, moving more distally to the proximal radial ulnar joint. This is a synovial pivot joint, and it's a pivot joint essentially because it is describing the articulating action between the head of the radius to the radial notch of the ulnar. All right, so if you guys stand in anatomical position, right, the thumb side will be where our radius is, and our pinky side will be where our ulnar is. And if you guys begin to rotate your forearm to supination to pronation, what's occurring about the radial ulnar joint is that the radius bone is pivoting or rotating around the ulnar bone. And the specific pivoting action is occurring between the head of the humerus, pivoting on the radial notch of the ulnar. All right, and this occurs both in the proximal and the distal radial ulnar joint. Now, as mentioned previously, the articulation here about this joint is reinforced by this annular ligament. And this ligament essentially holds that radial head in place. So that way that fit between the radial head and the radial notch of the ulnar is more secure. And it essentially secures the radial head as it engages in its pronation and supination actions. So in our anatomical position, we're starting off in our supinated position. And as we rotate our forearm to that pronation position, you notice again that the radial bone or the radius bone is rotating about the ulnar bone, right? And you kind of see this pivoting action occurring both in the proximal and the distal aspect. It's also important to note here that the radial bone is smaller compared to the ulnar bone on the proximal attachment. But as we move down more distally, and this region is where essentially our wrist is, the aspect of the radial bone is larger compared to the ulnar bone. So again, that's just another descriptive characteristic that I want you all to consider as you analyze the bones of the forearm. Now for this distal radial ulnar joint, again, we're dealing with a synovial pivot joint. Same mechanism as we will see as far as that pivoting action occurring about the proximal radial ulnar joint. The ligaments that reinforce the distal aspect of this joint will be our dorsal radial ulnar ligament, our palmar or our volar radial ulnar ligament, as well as the overall articular disc, all right? And unlike what we see in our proximal radial ulnar joint site, the distal site here, especially when these bones articulate with the carpal bones or our proximal row that make up the proximal aspect of our wrist, this is made up of fibrocartilage, right? So this triangular fibrocartilage complex is a load-bearing structure between the lunate, the tricutrum, and the ulnar head. The lunate and tricutrum bones are one of the acarpal bones of the wrist, and it articulates with the smaller ulnar head. I say smaller because we are dealing with the more distal aspect of the radial ulnar joint site, right? This is formed by the radial ulnar ligaments, ulnar carpal ligaments, as well as the varied triangular fibrocartilage discus. So whenever you guys see the word fibrocartilage, you already know that the overall purpose of this specific joint site is to provide some sort of stability. So it's the same event here in this case. All right, it provides stability to the distal radial ulnar joint, the carpal bones. It's responsible for the transfer of force between our hands all the way over, moving up the upper extremity kinetic chain. And it also provides the mobility and stability during forearm supination and pronation action. So the fibrocartilage here is incredibly important for providing stability as well as transferring the force that we have every time we engage in some sort of wrist weight-bearing action movements. So muscles here about the elbow and the forearm. For pronation, the muscles of note would be our pronator teres, our pronator quadratus, and our brachioradialis muscle. Very simple as far as the nomenclature here. I'll have you guys note for this particular joint site, the muscles that have the word pronator in front will obviously be responsible for the pronation action of the forearm. As I mentioned previously, the brachioradialis muscle is a jack of all trade. So not only is it responsible for the pronation action, it may also be responsible for that supination action. And this simply depends on where your forearm is located. The main purpose of the brachioradialis muscle is to position your forearm in that neutral position. So essentially in that fundamental position, especially when your elbows are flexed at 90 degrees. For the supination action, we have our supinator muscle, as well as the biceps brachia, right? So in order for our biceps brachii muscles to be fully activated, not only are we engaging in that elbow flexion action, our forearm also have to be in that supinated position. Remember, if we're in that pronated position, the muscle that will be most responsible for that action will actually be our brachialis muscle. Excuse me. Other structures here of note to consider, we have our various bursa sacs that can be found around the elbow joint. And getting into our brachial plexus here, the main branches of the brachial plexus that will mainly contribute to the action about our elbow and our radial ulnar joint regions will be our ulnar, radial, and median nerves. The ulnar nerve actually runs on the medial aspect of our forearm. And as far as the motor innervation is concerned, it's mainly responsible for half of our ring finger here and our pinky finger. For our radial nerve, our radial nerve actually branches off into a deep radial and a superficial radial or superficial radial branches. For the purpose of this class, it's not content that you all need to know specifically here, but either way, it'll run down on the lateral aspect of our forearm. All right, and our median nerve is just that nerve that kind of runs all the way down through here. Some overarching points as far as the vasculature is concerned. We have our subclavian artery. Our subclavian artery, once it passes the clavicle, most specifically the border of our first rib, it becomes the axillary. And the axillary artery will give off many branches, is not too pertinent for the content of this class. However, as far as the blood supply for the elbow and forearm region, it will mainly be responsible or mainly be contributed by the ulnar and our radial nerve. It bifurcates and it runs down along its respective bones. And looking over here for the venous drainage, at the huge vein that runs along the ulnar side of your arm, if you will, that's your basilic vein. And your basilic vein actually runs all the way up. On the lateral side, we have our cephalic vein. And just like the basilic, that as well kind of runs all the way up. We also have our brachial vein over here. And this brachial vein will run with the brachial artery. And this brachial vein will actually drain into the basilic. And the basilic will eventually drain into the axillary. As far as the cephalic vein is concerned, the cephalic vein will simply just drain into the axillary. So essentially speaking, both the cephalic and the basilic vein drains into the axillary. The only subcaveat here is that our brachial vein will drain into the basilic, which then drains into the axillary. Not incredibly important for this class, but I just want to give you all a general pathway as far as the vascular structures are concerned. Thank you all for your attention.